Good day and welcome to another series of Heart2Heart. It's my pleasure to introduce two of my colleagues to discuss some very interesting aspects of cardiac prevention. Today we're going to focus on nutrition, lifestyle measures, and some new ways of diagnosing coronary artery atherosclerosis. It's my pleasure to introduce Tiffany Ardoin, who's an assistant professor of medicine at LSU and an internal medicine physician, and Dr. Andrew Smith, who's with the Heart and Vascular Institute at Louisiana Cardiology Associates, an electrophysiologist and director of the cardiometabolic program here at Louisiana Cardiology Associates. I'm going to start off with an interesting case that I came across recently. This is a 49-year-old lady who presents to our clinic with a family history of heart disease, high blood pressure, high cholesterol, and newly had a test called a calcium score, which came out to be about 84. Tiffany, what are your thoughts on how you'd begin to manage this patient?
I'll let Dr. Smith talk a little bit more about the coronary artery calcium score itself, but I think when you have a patient coming to you with a strong family history and beginning signs of maybe having some atherosclerotic disease and some risk factors for having heart disease, I think it's very important to start that foundation of lifestyle treatment and preventative treatment. And ideally, this would have been done many years beforehand, but we know that the buildup of plaques is related to chronic inflammation and elevated lipids, and a lot of that chronic inflammation can be decreased by the proper eating and proper diet. So,
how early does this plaque start?
So we know that it starts early, late teens, early 20s, and it can develop over many years. And again, a lot of it depends on family history. It might be a little bit more progressive in some families than others, but it starts early. So the earlier you can get a jump on this, the better.
Tell me about the concept of food as medicine. So in many parts of the world, there's a lot of interest in developing the right kind of eating habits for people early on in age, but also later on in age. What are your thoughts on that?
So fortunately, we are having an awakening in the United States, and it kind of started with the 2022 White House Conference on Hunger, Nutrition, and Health, where we really aimed our focus at preventive medicine and the importance of nutrition to maintain health. We know that recently, I think it was in 2016, was the first time as far as risk factors are concerned for chronic disease, diet surpassed tobacco use as the leading risk factor for poor health and chronic disease in the United States. So this is very important.
So specifically to lower this patient's cholesterol and blood pressure, what are some of the tips you could give them?
So I always recommend a balanced diet. I think people are often looking for the new hip diet to improve their numbers or to improve their overall health, but really it's not that complicated. It's just eating whole foods, not processed foods, eating whole grains, vegetables, lean meats. It's a lot of what you'll see in the Mediterranean diet, which is what we typically the diet that has the most research behind it, but also the DASH diet, the MyPlate diet, they're all very similar. They're just marketed a little bit differently, but just an overall well-balanced diet, low in processed foods, high in vegetables and fruits and whole grains.
Dr. Smith, tell me how you use calcium scores in practice. This lady has an elevated calcium score with multiple risk factors, relatively young. How would you approach this lady in clinical practice?
Yeah, I think for her specifically, she's young, she's female. So for her, a score of 84 is an accelerated number. You wouldn't expect that at her age and being female specifically. So she has some risk-enhancing factors, some inflammation going on. So Dr. Ardoin's point, I think really getting aggressive with diet, really focusing on lifestyle changes. I think another point with her is she's so young for this score that a lipoprotein little a would be another test I would potentially get to also evaluate sort of risk-enhancing features with her.
You mentioned that lipoprotein little a, LP little a, and that's in our literature getting a lot of play right now. Tell me a little bit about that, and are there any treatments in development right now?
So lipoprotein little a is a risk-enhancing feature of LDL particles or your cholesterol particles, and it has an increased risk of atherosclerosis. It helps hold on to oxidized particles that increase atherosclerosis. There are no specific treatments for it now, but there are treatments that are being researched and will probably be available in the next couple of years. But certainly we do have cholesterol-lowering medications that in and of themselves can lower her risk. And then there's a couple that do lower the Lp(a) particle, specifically the PCSK9 inhibitors that can do that, although they're not specifically indicated for that.
Very good. I'd like to turn my attention to another case. This is a 58-year-old man with obesity, obstructive sleep apnea, again, hypertension, who weighs 298 pounds and is 5'8". How would your dietary and lifestyle approach be to this patient? Dr. Ardoin, what are your thoughts on this?
So again, I think that should be the foundation of treatment. This man has an elevated BMI, 45 plus, and has many comorbid conditions or obesity-related conditions. And so I think the foundation should be diet and exercise and those lifestyle measures. And, in counseling him, it would be a lot of, okay, what are you currently doing? And what are some things that we can do to change that? And a little bit of back and forth, being both a motivator and an educator in helping him to find some lifestyle measures that would improve his overall lifestyle for him, that was fitting for him. He also would be a candidate for both pharmacotherapy and actually now bariatric surgery. The guidelines have changed a lot over the past few years to where now people with a BMI of 30 plus other comorbid conditions are actually candidates for bariatric surgery. So we're being much more aggressive up front with surgical intervention because we know that it's long lasting, it's more cost effective. And so it's something to at least have him consider.
Dr. Smith, at the Cardiometabolic Center, the heart care center that you run, what are some of the therapies that you offer patients that have these metabolic conditions that Dr. Ardoin just outlined? Is there something specific?
Yeah, we start again, and I love your point about not being really specific with diet. Mediterranean diet, DASH diet certainly are proven diets, but a lot of these folks, like this gentleman, there's little things you can change that can really help him. Are they drinking sugar, full of sugar drinks, Coca-Colas, energy drinks, things like that? Other processed foods that maybe let's take the top one or two things he does. Can we eliminate or reduce those for him? And then certainly we don't go over the blood work for this gentleman, but 5'8", I think 298 pounds, he's definitely has some metabolic issues underneath the hood. He's got probably insulin resistance, almost certainly. He's probably got elevated triglycerides, elevated cholesterol. So we really, when you do the diet, you try the exercise, those things, and then in this gentleman, he almost certainly needs some other medical therapies, at least initially, to get his blood pressure down, to get his lipids in better line. And then certainly there's the newer agents for diabetes that have been very effective with weight loss, and initially diabetic agents, but now cardiovascular agents, weight loss agents. So those are the GLP-1s. We all know them as Ozempic and Mounjaro.
In our community, we have a pandemic of obesity and diabetes, and we've kind of covered the Mediterranean diet. We've talked a little bit about exercise today. What would be some of your closing messages to people in our community as to how they can live a healthier lifestyle, have less chance of developing diabetes and cardiovascular disease?
I would say finding something that works for you. I think not looking for the new fad thing that's going to be a quick fix, but looking for sustainable changes, small sustainable changes, incorporating your family or friends for some accountability and just a new lifestyle, and really using whatever assets you have, talking to your doctor to get ideas, to get more information about what you can do, and just small sustainable changes.
Yeah, I think Dr. Ardoin puts it really well. Small changes. Get off the couch. We recommend 150 minutes a week. Let's do 5 minutes a day. Just start. Start small. Walk down the driveway. There's a lot of people who aren't even doing that. Start small with the diet as well. Not everybody's going to be able to switch to a Mediterranean diet immediately, but if they can just reduce processed food, reduce some of the high sugar intake that a lot of us do every day. I think start small, make little changes, and those are more sustainable than full-scale changes.
Checking with that primary care doc would be the first step to getting further referrals to cardiovascular, internal medicine, physicians that have an interest in diet and lifestyle. In closing, what messages would you have for our patients and family members in general?
So I would just say be sure to start with small, sustainable changes that you can do. Look at what you're currently doing and maybe, do a little bit more exercise. Change a few things in your diet. Cut out the soft drinks, the processed foods, those kind of things, and just make small changes that you can sustain over time with the help of your friends and family. And definitely seek your primary care physician for some more advice on how to do that.
Dr. Smith?
Yeah, I couldn't agree more. Start small. Get off the couch. 5 minutes a day is enough to start.
It's my pleasure to have you both today. I've certainly learned a lot. I'm sure our patients and general public have as well. Thank you very much. Until the next time, this is Denzil Moraes signing off.